Born addicted, the ethical dilemma local doctors face when it comes to either forcing a patient to be in pain or delivering a drug-dependent baby.
It's all coming up straight ahead, and we're going to give you a chance to help the USO next on News 3 at 5.
This is News 3 at 5 with Jim Snyder and Jessica Moore.
Coming up, an adult with chronic pain versus a baby born into a life of addiction.
They're going to go through withdrawal like an adult would who is, for instance, on heroin.
Local doctors weigh in on the ethical dilemma they face when it comes to either prescribing pills or preventing drug dependency in newborns. Prescription drug abuse is on the rise in Las Vegas, and the victims are some of our newest, youngest neighbors.
A study published in the Journal of the American Medical Association finds the number of babies born addicted to drugs, including prescription painkillers, has almost tripled in the past decade. News 3's Marissa Mike talked to local doctors about that disturbing stat.
Some doctors argue there are pregnant women who need pain medication, but the choice to be pregnant on painkillers comes with major risks for the baby. It's not the sound of a normal baby's cry. That's a baby in distress, hooked on painkillers, going through withdrawals. It's called neonatal abstinence syndrome, or NAS.
They're born addicted.
Dr. Quinn Vo, a maternal fetal medicine specialist, says it's heart-wrenching to hear and see, but it happens all too often.
They're no longer getting medication because they're now at a mom's system. These babies are used to a certain amount of narcotic. All suddenly they're cut off. So they're going to go through withdrawal like an adult would.
Dr. Vo treats high-risk pregnancies and says Las Vegas is plagued by prescription drug abuse. But some of her patients, like Cherie Dubois,
I was involved in an auto accident in 2007.
are dependent on pain meds to function. They're described a prenatal plan packed with pain pills.
It almost feels like somebody, took a sledgehammer to your back.
Most of my patients, they don't want to say, okay, just because I'm on these medications, I shouldn't have a baby. They want to have their families. They want to fulfill their dreams.
While some doctors argue there are patients with legitimate pain, other patients pop prescription pills like candy. So who stops the addicts in their tracks? Perinatologist Joseph Adashek weighs in.
To just say, hey, you're pregnant, cold turkey, you're done, I'm not giving you any more. Fine. But if a patient, whether pregnant or not, is addicted to opiates, they'll just go find more.
By going to multiple doctors or turning to the streets for a fix.
Whatever it takes for them not to go through withdrawal.
To combat the problem, more and more states, including Nevada, track narcotic prescriptions given to patients through a digital database. It monitors patients and their doctors, but it's optional. Should it be mandatory?
To make things laws, then you end up under prescribing people who are truly in pain, and then you end up someone in horrible pain who's not seen another doctor, who does not have the disease of addiction, who needs pain medicine.
Doctors are forced to make the painful decision of how to treat pregnant mothers. Either the mom and fetus suffer through the pregnancy, or the baby could start its life dependent on drugs.
I see the potential life. I see this very innocent baby who has no control of these circumstances.
Many times the decision to keep a pregnant woman on minimal pain meds is the optimal solution offered by high-risk pregnancy doctors, but there may be long-term risks.
It's really hard to pinpoint down what exactly will happen to this baby.
We certainly know alcohol, amphetamines, cocaine, they definitely have long-term consequences. We don't know how much long-term consequences opiates have.
You say hi?
The possibility of a miserable newborn is not an easy concept to stomach, but sometimes babies miraculously escape the withdrawal symptoms after birth. Dubois already had one daughter while on pain meds. She's doing just fine.
She didn't have any withdrawal. No problems, completely healthy, still healthy to this day.
She's hoping her second child will be just as fortunate. Her little girl is due any day. It's a toss-up whether she will enter the world with a drug dependency like her mom.
We wish the best for them. Now, Dr. Vo and Dr. Adashek say, as it stands, addiction has a stigma attached to it. They say the way to solve our nation's drug problem is to treat addiction as a disease and not a moral failing by the patient. That way, expecting mothers will seek medical help instead of trying to hide their drug problem. Jim, back to you.
All right, Marissa, thank you for that.